Did you know that the glands in your eyelids play a crucial part in the health of your eyes? The Meibomian glands produce the outer layer of the tear film that helps protect our eyes and prevents them from getting dry. In this episode of OCuTALK, Dr. Janelle Davison will be telling us all about Meibomian gland dysfunction, the symptoms to look for, treatment options available, and ongoing ways to prevent future issues with these important glands. Dr. Davison?
I want to talk to you.
Not now, later.
No, now.
My name's Nick, and today we have a very special guest joining us. Please welcome Dr. Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. Everyone, please welcome Dr. Janelle Davison. Dr. Davison, thank you so much for joining us today.
Thanks for having me, Nick. I'm excited to be here.
Well, we're excited to have you here, Dr. Davison. Thank you so much for taking the time out of your day to visit with us. Before we begin our conversation, Dr. Davison, I was hoping that maybe you can introduce yourself to our audience. Let them know a little bit about your background and your specialty.
So my name is Dr. Janelle Davison, as you stated. I'm an optometrist practicing in Metro Atlanta. So I'm in Smyrna, Georgia, which is about 10 minutes north of the heart of the city. We see primary care, but my specialty is dry eye, ocular surface disease, and also some optometry aesthetics. We have been practicing solo, private, independent for about 15 years now. So this is my 15th year practicing solo, but my 17th year practicing optometrist in the Georgia area. We love what we do. We like the impact that we're making in the community, and we just like helping patients get to a role where their eyes are more comfortable. I like to say that we help you discover the root cause of your ocular discomfort and get you on the road to younger, clearer, wider eyes. So we enjoy seeing our patients.
Well, excellent introduction, Dr. Davison. Again, thank you for joining us today. So for our discussion, we were hoping you can talk to us about Meibomian gland dysfunction. And so first, before we talk about that, I wanted to ask, what are Meibomian glands and why are they important?
So that's a really good question. Patients ask me that a lot. And so Meibomian glands, the way I explain to my patients, they're glands and they live in your lid margin. So both top and bottom eyelids where they're housed, and they're responsible for contributing to part of what we call your tear film. And so I always explain to patients that a tear film is kind of like your body's natural eyeball lotion because it's made of different layers and it's responsible for hydrating hydrating the eye. So Meibomian glands live in the eyelid. They're responsible for producing the oily component of that tear film. And so if that oily component of the tear film is working at the capacity and you have enough water, you have that perfect mixture, that perfect film, your eye is going to stay hydrated.
Well, fantastic. I love the descriptions of the eyeball lotion. So I always like those little type of things that we get to learn a little bit about. So thank you for that, Dr. Davison. And so what is Meibomian gland dysfunction, or MGD?
So MGD basically sounds like it is Meibomian gland dysfunction. So your glands are dysfunctional. So over time, those glands can become what we call clogged or obstructed. And patients always ask me, well, how is this? What did I do? And so we're still learning a lot about MGD, but we do know that it's a high association with your blink capacity, your blink rate, which we know is automatically reduced when you spend a lot of time on a computer, kind of like what we're doing now, a device or a tablet throughout the day. There has been studies to show that your blink rate is decreased like nearly 50%. So throughout the day, you're blinking a lot less. And I'm saying that I used to tell my patients those glands aren't being triggered. So when you blink, that forces the oil out. And when you're doing that less and less throughout the day, you start to have oil that can get stuck in that little duct that can become hardened. And then when you finally do blink, you don't get enough to come out. One tough thing is if those glands stay clogged for an extended period of time, they can become atrophic, meaning they just kind of disappear, they wither away. I tell my patients that if you're triggering them and they've become clogged, the brain doesn't think they're needed. And so it just doesn't, allow that gland to produce the oil at the capacity that it should. So basically means that the glands start to get dysfunctional. If it's not caught, diagnosed, and treated, they can become atrophic and they're just gone. And so some of the patients that I get as a referral, they've been dealing with signs and symptoms of dry eye that are secondary to Meibomian gland disease for years that was not diagnosed or diagnosed and undertreated. And then they come to me and we are able to scan and we see that those glands have really just kind of disappeared, which makes it harder, not impossible, but harder to kind of manage those patients and get them where their eyes are more comfortable.
Well, fantastic information there, Dr. Davison. And you actually just talked about it a little bit before in your answer. And I did want to ask, you talked about not blinking enough and then, just staring at a computer all day. But what type of other causes cause meibomian gland dysfunction?
So poor diet. And so if you're not eating a nice balanced diet that has, we said the healthy fats. So the fats that you're going to get with your wild salmon, king mackerel, tuna, a lot of processed food will cause those glands to produce an oil that's really thick and unhealthy. Therefore, it's not going to come through that duct properly. Improper wear of makeup. We hear a lot about our eyelids and our eyes through makeup wearers. I am a makeup wearer. I have dry eye, I have MGD, so I'm an eye doctor, so I do better than most patients, but improperly applying your makeup. So putting makeup right along the lid margin can clog up those glands over time. Not removing your makeup each night can clog those glands up, as well as some ways that we treat acne. We treat acne with Accutane. And so we know that certain medications and certain therapies can make those glands basically draw up the wells and take all that oil out, harden that oil, and makes it hard for you to be able to blink and get that oil out. And then just a natural aging process. I tell patients, the eye is tricky. We can see our skin aging. We can see our hands aging. Like by my face, everybody think I'm like 20, but if you look at my hands, they tell that I'm well into my 40s. But it's harder to see your eye aging. So if you don't go to your eye care provider for us to be able to scan and to look, you don't realize that those glands over time are just naturally getting clogged and they're just not functioning properly. Luckily, which we'll be able to talk about later, that there's some treatments that are available nowadays to be able to help minimize a lot of that clogging and obstruction of those oil glands.
Well, excellent information, Dr. Davison. And actually, I wanted to ask you too, what are the symptoms that like a patient should look out for to indicate that, hey, I may have something going on, like meibomian gland dysfunction?
So a good one. So meibomian gland dysfunction leads to a part of dry eye where your tears evaporate too quickly. So when we talked about the oil component, I tell patients that's what helps your tears stick. So if you have dry eye, I got to make sure two things are happening. You got enough water. So that's something totally different that's producing water, the lacrimal gland. And then you need to have enough oils, and that's going to come from the meibomian glands. And so typically, if you don't have enough of that balance and you don't have enough oil, your tears are not going to stick long enough. So if you go outside in a windy environment and your eyes all of a sudden just tear, their tear is windy, or you could be sitting watching TV and your eyes should start to tear, or we call it epiphora. It means your tears are not sticking properly. Your tear film is not working. So the body starts to overcompensate. So excessive watering, which is hard to believe. Your eye is dry, but it's excessively tearing. You want to think of that a portion is not there because it should stick longer to stay hydrated. So excessive tearing. Also just gritty. You get a sensation where because the tears are not staying long enough that you feel like there's sandpaper or lash in your eye, but you never find anything. So a foreign body or gritty sensation. Another one is constant redness. I get a lot of patients, they don't have any of those other symptoms, but their eyes are always red. And that analogy I like to use if your lips are chapped. When they're dry, they get red, they can get flaky. So the eye is kind of the same, just stays red because your oil layers aren't moisturizing it enough. So typically some gritty sensation, excessive watering or tearing of the eye, and some redness are some of your common symptoms that patients will have. That sometimes if you're in areas like me in Georgia where it's high allergy, you don't know if it's an allergy, is it dry, maybe I just didn't get enough rest. So a lot of times patients don't know how to connect the dots.
Well, fantastic information again, Dr. Davison, and thank you for the analogies again. I also wanted to ask, how common is this?
It's pretty common. There's been studies that have shown that most of the dry eye, anywhere up to 80 to 85%, is secondary to evaporative, which we know is secondary to MGD or meibomian gland dysfunction. So most patients that have a drier eye, one of the things that we should be evaluating, and most eye care specialists who specialize in dry eye, we are looking at your oil glands. So it's pretty common. It's a good precursor. So a lot of patients that wear contact lenses as well, they start to have what we call contact lens dropout. So even if you get a few of those glands that are just not functioning properly, that film is not going to be thick enough, and then your contact will start to adhere. And so contact lens wear. So it's really common. So I'm always kind of screening my patients, asking probing questions, and I'm looking at those oil glands, and I can push on them and express them while I'm doing the slit lamp exam to see if oils are coming out, and if it comes out, what does it look like? There's a certain way it's supposed to look, and they should come out if I press on those glands.
Fantastic. And so we know that it's very common. So how can someone avoid getting MGD? Can we avoid it?
That's a good question. Obviously I can't predict the future. So I usually say you definitely want to go and have regular eye exams so we can see what your risk is. We evaluate it. But there are some home remedies that we suggest. And naturally, I suggest make sure you're managing your computer and device time. Take breaks. There's been a recent study out now that showed that maybe the 2020 rule may not have been as effective as we thought it was, but just simply closing your eyes for 2 to 3 minutes if you can, just letting your eyes rest is kind of let things reset. That's one. I talked about dietary. So if you're, eating a lot of processed foods, a lot of fast food, really good about having some fresh fish, wild fish, getting that good fat, then you can easily modify those things in your diet or take supplements. And a little thing I want to say about supplements, you want to be careful. You want to make sure that you're taking a quality supplement. A lot of things that patients will self-prescribe with, especially with supplements, are alcohol-based, and the body is not going to process it. So definitely, talk to your primary care doctor, your eye doctor, see what the best supplement is. And then if you're starting certain medications like Accutane, or if you're going through chemotherapy, just kind of make sure you let your eye doctor know prior or while you're in the process of those things, so we can do as many things as we can to help manage. Warm compresses and then lid hygiene are two big things that you can just do mainly daily that will help minimize some risk.
Well, fantastic. And so we talked a little bit about what we do daily and what we can do for home remedy. So what happens if something it gets a little bit worse and like I know it's time to go see a professional. I need to go see Dr. Davison about my MGD. When should I go and see you?
So you should see me once a year. And so annually we recommend an eye exam because I tell patients I'm screening for all these things. But let's say you're not up to date on your eye exams. We'll use COVID as the excuse. Most people haven't been in since COVID. But if you're noticing an uptake in some of those symptoms that we talked about. So I always like to break the symptoms down to episodic. What do you mean here and there? Like you get a headache here and there, no big deal. You take Tylenol, you're good. But if you were to get a headache every day, you have to take Tylenol every day, you would think something's wrong, right? So if you're taking artificial tears every day, every 20-30 minutes, you're having to do warm compresses, you're not feeling any relief, your eyes are constantly red, you try some over-the-counter remedies and those things aren't improving, then definitely come on in and see your eye care provider. If you're in the Atlanta area, come see me because we do have the diagnostic testing to not only get the right questions asked, but we can actually screen and image those meibomian glands, which is really cool when you can see what your own glands look like.
Well, that is pretty cool. That's very interesting information there, Dr. Davison. Thank you for that. And so what happens if this goes untreated? I know, like you said, some people aren't up to date, and I know, they're like, it's fine. I know, I'm doing this warm compress and stuff all the time. But what if it goes untreated? How can this condition contribute to other eye problems?
And so the main eye problem it will contribute to will put you into a phase of episodic dry eye to dry eye disease, right? So like I said, when those glands are not handled and treated, they become atrophic. So they atrophy. And once they're atrophy, right now we're doing a lot of research, but we still technically say we can't rehab we can rehab, but we can't regenerate. We can't bring those glands back. And so let's say you're supposed to have 60 glands total between the both lids. If you have 20 functional glands, it's going to be really hard for you to have an eye that is comfortable regularly. I do a lot of patients that have severe dry eye, and a lot of it is secondary to evaporative, secondary to MGD, right? So they have MGD that was never diagnosed, and now they have this painful, gritty, red eye that, is really hard to manage so that they're comfortable. And unless you have dry eye, people think it's just, I just have dry eye. I have dry eye. And there's days that when my eyes are bothering me so bad, I literally want to rip my eyes out of my head. It's like in the socket, I'm blinking, I can feel it's not comfortable. And it's very, very hard when you have glands that are completely atrophic to really get the eye comfortable daily. So main thing is dry eye disease. And then also if they're left unclogged, it's going to really diminish or affect your overall lid hygiene. So it will put you in a state where you're doing constant daily things that you have to do to try to keep your eyes comfortable.
Well, fantastic information, Dr. Davison. And earlier, you mentioned that you had some tests that you run in office. What type of tests do you run for meibomian gland dysfunction? What is your diagnostic process like? And
so I always tell patients that we look for the root cause. So I'm looking for everything, but because I know that most dry eye is secondary to MGD, we do have a meibographer here. And so we have partnered with Oculus, Keratograph 5. And so I like that dry eye suite because it's able to do a gamut of dry eye tests that is really going to look at each structure that's involved in keeping the eye hydrated to really see what's not working or what's dysfunctional. So the meibographer allows me to use an infrared light to be able to scan the glands, both top and bottom. A lot of times we'll scan the bottom first, because scanning the top, you do have to flip the eyelid. Some patients kind of get, queasy when it comes to that. It doesn't hurt, but usually we can look at the bottom lid if we have a lot of dysfunction there, because it's going to be the first area to go, a lot of clogging or atrophy there. We can flip and we can kind of get an idea of where, what the top is going to look like. We use special dyes. And so if those glands are dysfunctional, we'll put special dyes in the eye and they'll illuminate areas of the eye. And if things aren't covered or sticking as long as they should, we can determine that you're just not getting enough oils to cover that area. And then in addition, we're able to express the glands. So like I said, I can manually express the glands. Then we also have some probers that we can use that will express the glands so I can see what the oil looks like. It should look similar to olive oil, not toothpaste or butter, not really thick, and it should express pretty easily. So I should be able to push on the glands. Now you should say it should erupt like a little volcano of olive oil. It shouldn't be really hard to come out and very thick when it comes out. And so once we are able to run all those tests, I'm able to kind of show a big collage of everything that we've done to the patient, and we usually discuss kind of what the best treatment course or plan of action is for that specific patient.
Awesome, Dr. Davison. Thank you for that. And I also wanted to ask you earlier, you said that, you see a lot of patients who are just, they keep their makeup on all the time, and it probably contributes to this happening. I wanted to ask, are some people more prone, like people who wear makeup, or more prone to getting MGD, or is it just common amongst everyone?
Well, everybody can get MGD. Even children can get MGD. Like I said, the biggest culprit is, just our decrease in blink rate. And so a lot of us are spending time. So my youngest daughter, who is 11, has MGD, and I've scanned her glands and everything. But poor makeup habits. So it's not the makeup. The makeup is not the bad thing in most cases. Check ingredients. We'll talk about that later. But it's usually the person who's using it, right? So they usually poor application. So they're putting their makeup in places they're not necessarily supposed to go. So some popular terms are putting liner on your waterline. So that means you actually physically put a liner right on the kind of the wet part of the gland, and then they call it a wet part of the lid, or a tight lining, where they put liner on the upper lid, and those will all your glands leave. And then not properly removing your makeup, right? And so either not taking it off at all, or just using like a makeup wipe and not going behind and really cleansing, getting that debris off of there, and then resetting the normal load of bacteria. What I usually say, we have normal flora. So there's certain washes and wipes and things that you can use to help reduce the chance of that happening. And just not just mainly it's just the makeup, the applicator, not the makeup itself. Now, there are some makeups that have really poor ingredients. I tell patients that a lot of the cosmetic industry is not regulated, and a lot of those regulations have not been updated since the 1930s. So there are apps and things out there now that you can scan the product, get a better idea of the ingredients that's in that product, and it'll kind of flag and say, red, green, or yellow, like this is not good. You may want to find an alternative. And there's a lot of other makeup lines that are more vegan, more organic, natural. And there are even some lines that are formulated by actual eye care professionals themselves. So they make sure that those ingredients are going to be safer. There's no complete way, preservatives and things, you need those things in your makeup, right? But there's ways that you can minimize some of those things that are going to cause some issue to the ocular surface. So makeup, I wear makeup. I don't want to give it a bad rap. It's just that you have to be able to make sure you take it off and know what you're putting around your eye.
Well, fantastic information, Dr. Davison. And on that same line of makeup, I wanted to ask, what about eyelash extensions too? Does that help contribute to Meibomian gland dysfunction as well?
Yeah, when I lecture, I just joke that I thought the eyelash extensions were gonna kind of come and go, and I think it's here to stay. And so yes, anytime you're putting something, foreign around that lid margin, what that's gonna do is increase your risk of what's called blepharitis or Demodex blepharitis. So increase the bacterial load, which that contributes to MGD. And so once again, it's not necessarily the lash, it's the application not properly cleaning. A lot of your individual lashes, they individually go on each lash. It's expensive. There's certain glues that hold them on. And unfortunately, a lot of people that use them don't want to clean properly because they don't want to quote unquote break the bonds. They don't want their lashes to fall out. So they'll rather let bacteria build up, which will increase their risk of MGD. So once again, proper hygiene and cleansing. And so even if you get a cleanser from your lash artist, if you're going to wear lash extensions, just have a conversation with your eye care provider. I think a lot of us now know that saying no is not just the solution. Most people are going to do it. We're learning. I'm out educating and teaching my colleagues. They're going to do it. Let's sit there and let's kind of mentor them through the process so that we can minimize a lot of the risks that are associated with it. So have that conversation with your eye care provider so that way they can give you proper ways to clean and manage and kind of give you a schedule on how often you should have your lashes refilled. So that way you minimize risk as much as possible to your oil glands.
Oh, well, fantastic, Dr. Davison. I want to kind of expand on that a little bit more. You just talked about it with your patients about talking about eyelid hygiene. When it comes to MGD, what do you talk to your patients about? Like, what's the best, eyelid hygiene advice that you can give them in the process that they need to go through?
So I try to explain to patients because they ask a lot of things like you're doing, with blepharitis, Demodex, MGD, is there anything I could do to minimize it? And so we're still getting the word out. I tell patients there was a time when we didn't brush our teeth normally, back in the day, and people would lose their teeth and they realized if we just kept them clean, we can keep most of our teeth in our 70s and 80s. So the same thing, if we want to try to preserve as much of our oil glands as possible, we've already kind of equated that the computer is there, but daily hygiene. Most things that you clean your face with are not approved to go on the eye. You look at the bottle. And so we need something that we can cleanse our eyes with daily, meaning our eyelid, the tissue around the eye. So I usually recommend either wipes, foams, or gels. It really just depends on the level of what their tear film looks like. So each one works a little bit differently. And then I usually recommend that they have a concentration of a cleansing agent that is safe for the eye. And so there's been some a little bit of backlash with tea tree oil, and is it good or bad for the meibomian glands? But tea tree oil at super high concentrations, not regulated, yes. Low concentrations of tea tree oil that is regulated by an eye care provider is a little bit safer. So tea tree oil wipes, wipes that have hyaluronic acid or spray, HOL spray that's produced by the body, which is a natural antimicrobial, natural antiviral. Those are things that you can use nightly after you take your makeup off or cleanse your face. Then you go behind and clean the lid and the eye margin or spray. And then usually I say, at least once or twice a week, a warm compress. So that's going to help try to keep the oils inside the glands comfortable. So usually wipes, gels, or foams, either they're going to be a slight concentration of tea tree oil, so usually a very low concentration. And I like ones that are infused with another natural oil like almond oil or coconut oil or castor oil. So infused with the oil and tea tree oil. And then, or you can have your HOL spray. And so once again, I say those things, but people like to self-prescribe a lot. And so it's okay to do over-the-counter things, but you should still do those things under the care of an eye care provider. So have these conversations. Mostly us when we want to talk about it. So ask us if we're not already giving you the information. So that way you can, do properly hygiene. That's going to be a long-term benefit for you versus something that, may be causing more issue than not.
Well, fantastic, Dr. Davison. And I know we've talked about it a lot throughout this conversation, but again, how important is eyelid hygiene when treating Meibomian gland dysfunction?
It's very important. If we do in-office treatments, which we'll talk about, and usually I'll put you on a maintenance schedule or home therapy. So home therapy is basically equivalent to like you brushing your teeth and washing your face each night. You need to add this eyelid hygiene part to it. And those are going to be the thing that's taking care of the whole body. And that's going to help keep your meibomian glands functioning, reduce your bacterial load, which helps to minimize your risk of MGD, which we know is a big precursor for evaporative dry eye. So eyelid hygiene is very important. So especially if you wear makeup, I tell patients, if you're wearing makeup, you need to remove it with a makeup wipe, but then also you need to have a lid hygiene system that is recommended by your eye care provider so that way you can make sure that you're not only cleansing, but you're restoring the normal biofilm or bioload, so that way you don't increase your risk of MGD.
And so also on that note, how important are the in-office treatments that you give to your patients?
They're really important. We're lucky enough to be able to offer some of the advanced treatments to our patients who maybe have had home therapy and it's not as effective for them, or I have some patients that say, Doc, I'm telling you right now, I'm not going to be able to do that every night. And so they're able to come into the office where they're doing advanced cleanings of the lids or advanced treatments that are targeting the oil glands in the office. But I think those are very important. There's some patients that come in and we grade everything kind of, I say patient scale of 1 to 4, 4 being the worst. And I have patients sometimes when they're coming, they're graded for their MGD or their blepharitis Demodex. They're already at 3 or 4. Just offering a home therapy for them is not going to be enough. I need to be able to offer an in-office treatment, which we offer treatments that, like I said, target the lid margin to clean the eyelid. So we have automated ways to be able to go in and clean the lid margin in the office, and maybe using a little bit higher concentration of some of those formularies that we talked about before, the tea tree oil and other cleansing agents that you wouldn't use every day at home, but we're able to kind of do a deep cleaning in the office. And then you want to be able to complement that at home with a home therapy treatment. And then we have treatments that specifically use heat that are at a higher concentration that you can get in a warm compress in the office, and sometimes a light-based heat to be able to directly address those meibomian glands. And then, of course, you got to complement that at home to give you a more long-term benefit. So like I say, you want more days where your eyes are comfortable than not. So those home therapies are always going to kind of be a part of the treatment plan, whether you're doing them daily or also patients, okay, we're at a really good point now. Typically when things get better, people start to slack, right? And so it's telling them just completely stop and say, okay, I need you at least once or twice a week, do X, Y, and Z, right? Because once their eyes start to feel better, they naturally just kind of get lax and don't do things as often as they should. But I like to kind of let them know what is the least amount you need to do throughout the week versus just not do anything.
Well, fantastic information, Dr. Davison. And before we leave today, was there anything else that you'd like to let our audience know about?
And so I appreciate the conversation on MGD. I think, it's awareness is important. A lot of things about the eye, especially the ocular surface disease. I mean, we have advanced so much in the last 10 to 12 years. So, shows like this and podcasts like this that are targeting the community so that they have a better awareness, I think is just very great. Thank you for having me on here. If you're listening, you're experiencing any of those symptoms, or you're not sure if it is allergies or dry eye, or you just need a new pair of glasses, I definitely encourage you to visit your eye care professional, because we're trained, we're there to help, and we're ready to help keep your eyes comfortable and reduce your chances of MGD.
Well, awesome information again, Dr. Davison. Everyone, that was Dr. Janelle Davison. Dr. Davison, thank you so much for joining us today.
Thank you for having me.